In the top stories, taking the COVID-19 vaccine doesn't mean letting down one's guard, says Prime Minister Harris. Health Ministry launches probe into COVID vaccination of businessman in Guyana, and Italian ambassador among 3 killed in attack on UN convoy in the Democratic Republic of Congo. Hello and welcome to the ZIZ Midday newscast. Today is Tuesday, the 23rd of February 2021. I'm Jason Davis. Nationally, St. Kitts and Nevis implemented its vaccine rollout plan on Monday at the Newtown Dental Clinic during a brief ceremony held as part of the government's national COVID-19 vaccination rollout and awareness campaign launch. Prime Minister Dr. the Honorable Timothy Harris, who was one of the first persons to take the AstraZeneca Oxford University vaccine against the novel coronavirus, said that although a vaccine is available, persons should not let their guard down as the virus is still active.
At this significant watershed moment, the country at large must be reminded it is not over. It is not over until we achieve herd immunity. It is not over until our neighbors achieve herd immunity. Therefore, we must all continue to take the prescriptions given, the wearing of our masks, the hand hygiene, the physical and social distancing. We must take them to heart and abide by them even as.
Prime Minister Harris encouraged others to get vaccinated.
We want, as the Chief Medical Officer says, that everyone should come forward in his or her self-interest and be vaccinated. That way you save not only your life, but you make an effort to save that of your loved ones. So I want to invite everyone. It is also being made available free of cost.
Other ministers of the federal cabinet, including Deputy Prime Minister the Honorable Sean Richards and the Minister of Health the Honorable Akila Byron Nisbet, were among more than the 50 persons to take the COVID-19 vaccine. Additionally, frontline workers, the Commissioner of Police Hilroy Brandy, and members of the National COVID-19 Task Force were also vaccinated. On tonight's edition of Leadership Matters, Prime Minister Dr. the Honorable Timothy Harris and his guests will take an in-depth look at St. Kitts and Nevis's COVID-19 vaccination plan that was officially rolled out on Monday. Prime Minister Harris will be joined on tonight's program by the Permanent Secretary in the Ministry of Health, Dr. Dolores Stapleton Harris, Chief Medical Officer Dr. Hazel Laws, and the Medical Chief of Staff at the JNF General Hospital, Dr. Cameron Wilkinson. The panelists will update the nation on the vaccination plan for all citizens and residents and seek to address the misinformation being circulated as it relates to COVID-19 vaccines. On Monday's official rollout of the Federation's plan, Prime Minister Harris, other ministers of government, and a number of frontline workers were among the first batch of persons to be administered the AstraZeneca Oxford University vaccine against the novel coronavirus. Leadership Matters, which begins at 8 p.m., simulcasts on ZIZ Radio and other participating radio stations. It's also streamed live on social media platforms, including the Facebook and YouTube pages of the St. Kitts and Nevis Information Service. The Eastern Caribbean Central Bank is inviting the public to part 2 of the discussion on pandemic and digital transformation, which will be the focus of the next session of ECCB Digital Dialogues, which resumes on February 25. The Governor of the Eastern Caribbean Central Bank, Timothy Antoine, will moderate the session, which will continue to explore how digitalization has transformed the economies and societies of the Eastern Caribbean Currency Union as a result of the COVID-19 pandemic. The panel will comprise Minister of Information and Communication Technology, the Honorable Akila Byron Nisbet, Head of Regulatory Affairs, Caribbean Cable and Wireless Communications, David Cox, and Technical Advisor in the Office of the Prime Minister of the Bahamas, Christy Powell. The panel will discuss how infrastructural gaps and inequitable access to connectivity and digital tools due to the pandemic can be addressed to safeguard the region's economic recovery, resilience, and transformation. The ECCB Digital Dialogues will be broadcast live on the ECCB's Facebook page and YouTube channel and on radio stations across the ECCU from 10 a.m. on Thursday. We now move to news on the regional scene. In Guyana, an investigation has been launched to determine how a non-frontline healthcare worker was allegedly immunized by a senior official of the Georgetown Public Hospital Corporation. Tamika Rodney of HGP News reports.
The AstraZeneca vaccine, which was almost 2 weeks ago procured from the government of Barbados and administered to hundreds of frontline healthcare workers to date, was recently erroneously given to a city businessman allegedly by a staff of the Georgetown Public Hospital. The 3,000 doses of the vaccine were strictly allocated for the immunization of frontline healthcare providers, after which the elderly and persons with comorbidities would later be inoculated with an additional tranche being sourced from the COVAX facility. Minister of Health Dr. Frank Anthony, in providing an update on the incident on Monday, pointed out that it is a total breach of the protocol in place by the senior member of the hospital.
We have an investigation that is ongoing to find out how it is that that person who came in and got a vaccine who is not a frontline worker. That's a total breach of the protocols, that because the first set of people that we want to get vaccines are those who are most at risk. And therefore we have to investigate and see why this breach occurred and to make sure that we correct for it so that no future breaches like this would ever occur again.
Nightly News understands that the businessman took to social media to boast about taking the vaccine, an action which alerted members of the media to the discrepancy. Dr. Anthony further disclosed that 1,852 frontline healthcare providers have been administered the first jab of the vaccine to date. He stated that they will all receive the booster dose of the vaccine within 8 to 12 weeks from the first dose, and likely from the next tranche of vaccines expected within a week's time.
We would get the AstraZeneca vaccine coming in, and so we'll be able to give those persons who got the first dose their second dose with the next batch that is coming.
Okay. Meanwhile, when asked for an update on the probe into the death of Police Constable Rockcliffe Cozier, who reportedly died last Tuesday after receiving 2 doses of a vaccine for chickenpox, in addition to taking filaria prevention pills, Minister Anthony disclosed that details surrounding his death is pointing to something else.
There has been a post-mortem that was ordered for us to get a better understanding of what went on. That post-mortem was conducted on Friday. The preliminary information that I have is that the taking of the vaccines and the tablets are not the contributing factor to his death, and therefore once I get the complete report I'll be able to make a better, or at least to give more information.
Cozier of Supply Eastbank Demerara, who was stationed at Police Division No. 4B, died about 15 hours at the Georgetown Public Hospital Corporation. Tamika Rodney reporting for the HGP Nightly News.
In Trinidad and Tobago, some agents purporting to be working for vaccine companies have been attempting to take advantage of the country and sell overinflated and possibly fake vaccines. This was revealed by Prime Minister Dr. Keith Rowley, who says this is why Trinidad and Tobago has to be careful to buy only from authorized dealers. But he admits that small countries such as those in the Caribbean have been finding it difficult to engage in talks with suppliers to buy these vaccines. Sunil Lala of TTT News reports.
Some companies will not talk to you unless you could buy 3 million doses. There is no way Trinidad and Tobago even needs 3 million doses, can store 3 million doses, or pay for 3 million doses.
Health Minister Terence Dayal Singh says this is the current situation being faced by many small states around the world. His comment came after Prime Minister Dr. Keith Rowley responded to statements by opposition MP Dr. Richard Secharan as to why other Caribbean countries are rolling out vaccines while Trinidad and Tobago is yet to receive its first batch via the COVAX facility. Dr. Rowley explained that Barbados and Dominica made a request from India due to an overwhelming increase of COVID-19 cases. He admitted that it has been difficult to have bilateral talks with manufacturers of the vaccine.
It appears as though what is happening now is that if your order is a small order, you have no place in the line at this time.
Dr. Rowley noted that the vaccines through the COVAX facility range around US $5 and is less than $4 in India and Europe. But he says agents have been trying to take advantage of this country with prices upwards of $20 and $25 a dose.
I know of one instance where a local agent of one of the major manufacturers of this vaccine has advanced himself as an agent for the company and sought to get contracts here in Trinidad and Tobago to supply that vaccine. The local agent would have communicated with its foreign superior, only to be told, call the police.
Mr. Dialsing said these people have been reported to local agents of manufacturers who would treat with the matter. Dr. Rowley noted that he's also concerned about the COVAX facility due to vaccine inequity globally and said this is why CARICOM is attempting to get a second line of vaccines via the African Medical Council.
That the way it is going, the distribution of these vaccines and the behavior of some of the countries and those countries that are producing and using vaccines within their borders, that they are not acting in solidarity with the rest of the world nations.
Health Minister Dialsing said in the next few days, this country will know the expected arrival date of vaccines via the COVAX facility. Sonolala, TTT News.
Internationally, Italy's ambassador to the Democratic Republic of the Congo, an Italian policeman and their Congolese driver have been killed in an ambush on a World Food Programme convoy in the eastern DRC. Luca Atanasio was on a mission in North Kivu province, an area teeming with armed groups. No police or security forces accompanied them. Italian Foreign Minister Luigi Di Maio expressed his great dismay and immense sorrow over the attack. Al Jazeera's Catherine Soy reports.
They were on a mission to Ruchuru in North Kivu province to visit a school feeding program, one of the many World Food Programme projects Italy supports in the Democratic Republic of Congo. Their journey ended here in the Virunga National Park, several kilometers from the provincial capital, Goma. The Italian ambassador, his bodyguard, and their driver were killed in a crossfire between park rangers and gunmen during an ambush on their convoy. Several other people were injured.
We are activating all the relevant institutions to get to the truth as soon as possible about this cowardly attack that these two servants of the state of ours have suffered from and lost their lives.
But beyond the shock of what has happened, questions will be asked as to why the convoy did not have a UN, national police or army escort in such a dangerous area. The authorities in North Kivu say they were not aware the ambassador was in town. WFP says it had been cleared to use that road without escort.
The location of this attack is almost exactly the same place where two British tourists were kidnapped in May 2018. So it's kind of real evidence of this long-standing security lapse in the region. It was also very close to where 6 Virunga guards were killed in last month.
This is the first major attack on a big UN organization like the WFP. But the park is steaming with rebels who target game rangers, civilians, and other NGO convoys to steal, kidnap, and demand ransom. The security problem, however, goes beyond this part of North Kivu. More than 70 rebel groups control much of eastern Democratic Republic of Congo, extorting villagers and attacking their homes at will. In Beni, north of Goma, many thousands of people, including UN and government soldiers, have been killed and more displaced by the Allied Democratic Forces rebel group. Thousands of soldiers are on the ground battling different armed groups, but with limited success.
We're looking at a kind of long-standing funding issue for the Congolese army in that area, a lack of kind of security planning as well as strategy when it comes to trying to combat the armed groups who operate in that area. MONUSCO, obviously the UN peacekeeping force that has been operational there for a good number of years, has a lot to answer for with regards to insecurity in that area.
Many Congolese in these areas live in constant fear, hoping but not confident the forces that have struggled to defeat the rebels for years will one day succeed. Catherine Soy, Al Jazeera.
Present weather shows clear skies with a moderate breeze of 15 miles per hour from the east. Temperature for today is 28 degrees Celsius or 82 degrees Fahrenheit. Seas are moderate with waves of 5 to 7 feet. Small craft operators should continue to exercise caution, mainly in coastal waters north and east of the islands. The weather today will be partly sunny in general with mostly sunny skies during the afternoon, and for tonight expect fair to partly cloudy skies with a 40% or moderate chance of brief passing showers, mainly after midnight. Sunset today will be at 6:16 p.m., sunrise tomorrow at 6:32 a.m. And that brings us to the end of the ZIZ Midday Newscast. Join us this evening for these stories and more in detail. Thank you for tuning in. I'm Jason Davis.